Welcome to the Explainer. Right at this exact second, an incredibly dynamic, forward-moving process is happening right inside your chest. Today, we're mapping out the foundational anatomy of the lungs. We're going to trace a single solitary breath from the outside world, all the way down to the microscopic level. Let's get right into it.
Go ahead and take a deep breath in for me. Now let it out. Behind that seemingly simple, totally automatic reflex is a silent, tireless engine. It's working continuously, around the clock, just to deliver oxygen to every single cell in your body. It is an absolutely incredible, nonstop process. Today, we're popping the hood on that engine to see exactly how its basic anatomy drives everything else we do.
Section 1. The silent engines. Okay, let's dive into this. To really grasp how these organs work, we first have to look at their physical setup. Picture your lungs as two soft, super spongy organs sitting right inside your chest cavity. And because they are so vital, and honestly pretty delicate, they need a really robust security system. That is exactly what your rib cage is for. It wraps around these spongy organs like a protective shield, keeping them safe from the outside world. And right beneath them, they sit directly on top of the diaphragm. Now, the diaphragm is the absolute main muscle responsible for your breathing. It's the literal foundation that supports these organs and drives the physical mechanics of every single breath you take.
Section 2. Right versus left lungs. Now, what's really interesting about this is, well, because we have two lungs, it's so easy to just assume they're perfect, identical twins. But actually, scratch that, they aren't. The right lung is noticeably larger and divided into three distinct sections, or lobes. You've got the upper, middle, and lower lobes. The left lung, on the other hand, is slightly smaller. Why? Because it has to share that tight chest space with your heart. So it only has two lobes and features this brilliant structural adaptation called a cardiac notch. It's literally a physical indentation carved out specifically to house the heart. It's just a perfect architectural fit inside your chest.
Section 3. The airway pathway. And this brilliantly illustrates the actual journey. The very moment air enters through your nose or mouth, it shoots down the trachea, which you probably know as the windpipe. From there, it hits a fork in the road, dividing into the right and left main bronchi, one going to each lung. Once inside the lungs, this whole network rapidly branches out, kind of like an upside-down tree, into smaller and smaller tubes called bronchioles. This keeps happening until the air finally arrives at its ultimate destination, millions of tiny, microscopic air sacs known as the alveoli. Section 4. Alveoli and gas exchange. So the crucial point here is that we really have to zoom all the way into the microscopic level, because these millions of tiny air sacs, they are the true functional units of the lungs. Their paper-thin walls physically meet up with a network of tiny blood vessels called capillaries. And this exact intersection is where the magic of gas exchange happens. Oxygen moves from the air straight into the bloodstream, and carbon dioxide moves from the blood back into the lungs to be exhaled. What's absolutely mind-blowing is that this dual-action trade-off is happening simultaneously with every single breath you take. The fresh oxygen your body craves is rapidly loading into the blood, and the waste carbon dioxide you don't need is being offloaded in real time, just waiting to be exhaled. This perfectly synchronized exchange across those tiny capillary walls is literally the essence of life. It's the ultimate payoff for that entire airway pathway we just tracked.
Section 5. The protective pleura. Let's move to and see how this builds out practically. Zooming back out for a quick second, think about all this expanding and contracting. We're talking thousands of times a day. To keep this massive, moving structure protected and completely friction-free, each lung is entirely wrapped in a thin, double-layered membrane called the pleura. Nestled right between these two layers is a small amount of fluid that acts as a crucial lubricant. It significantly reduces friction as your lungs continuously slide against the inside of your chest cavity. This incredibly elegant design is entirely focused on, quote, allowing the lungs to expand and contract smoothly with every breath. Without this double-layered membrane and its lubricating fluid, the constant mechanical friction of breathing would cause severe irritation. Seriously, you'd feel every single breath. Instead, it's a beautifully calibrated system that ensures the uninterrupted rhythm of your breathing remains totally seamless. From the asymmetrical lobes all the way down to those microscopic alveoli, the lungs are just an astonishing piece of biological engineering. They're perfectly designed to deliver oxygen and remove carbon dioxide with every single breath you take. And look, understanding this basic anatomy is really just step one. If you're eager to dive deeper and see how this all comes together in clinical practice, you can keep learning with the Auscultation World app. It's a fantastic resource where complex respiratory medicine becomes simple,
practical and super easy to understand.
Which leaves us with one final thought to chew on. We've traced the silent journey of a simple breath today. But really consider this. How does mastering this baseline anatomy, the mechanics of the lobes, the protective pleura, the incredible gas exchange in the alveoli, how does that unlock the absolute deepest complexities of respiratory medicine? Because once you understand exactly how the machine works, you can finally begin to understand how to fix it when it breaks. Thanks so much for joining me on this explainer. See you next time.